All right, welcome back. This one's going to be all of the GI drugs. Quick and dirty, like nursing students want it. They want to get the information quick. Give me the hit points. You're going to get it right now with the pharmacology GI drugs. I'm Nurse Nick. I'm an AHA, American Heart Association, ACLS, and PALS instructor. I'm also an emergency department nurse and a pharmacology instructor at college. And we're going to be going over all of the GI drugs from the previous videos really quick. So misoprostol, this is also known as Cytotec. I also give it an OB for what? We're going to give it to induce labor, right? But we're talking about GI right now. So misoprostol is going to be given in GI drugs to prevent ulcers from people that are taking NSAIDs on a regular basis, right? Or just prevent ulcers in general. Also, we're going to talk about the GERD medications. So the first one, there's 3 different ways we treat GERD: Sucralfate or Carafate. Carafate coats. So Carafate's the one you're going to drop down your stomach. I think that it creates an explosion down there. It creates a paste on the wall, so it protects ulcers that you already have from that acid coming back and burning and staining. But this medication may cause constipation. What's education with constipation? Fluid, fiber, and exercise. Take an hour before meals. Take an hour before bedtime before you lay flat, because positional changes may also cause GERD, right? So the next one is going to be your antacids. With the antacids, you all know that sodium bicarb is a buffer. The next one is magnesium. Magnesium can cause diarrhea. And then you have calcium and aluminum. Calcium and aluminum cause constipation. Constipation, education, fluid, fiber, and exercise. And again, with calcium carb, when you take this in, it should be taken an hour before or an hour after you take other medications, because it might mess with the absorption. The next one is going to be the ranitidine. This is the 3rd way GERD is treated, and this one decreases acid, right? This usually ends with diene, like famotidine. Famotidine is going to be your Pepsid. So this is given to treat gastric ulcers. It decreases the acid secretion, blocking the H2 receptors, the histamine 2 receptors in your stomach from secreting acid. But look for the bacterial colonization. Look for people with infections. What are signs of infection? Right? Fever, tachycardia, things like that. The next one is a proton pump inhibitor. This one ends with azole. I don't want you to be mistaken, because a lot of people remember antifungals have the suffix of medication that end with azole. You remember a sole of my foot, feet get fungus, azole. But this one is an exception to the rule. Pantoprazole or omeprazole is a proton pump inhibitor that also decreases acid secretion. So a lot of people, you need to consider as well, who are the people that are at risk for getting GERD? These are going to be people that are also in the hospital, right, with low movement or always laying back in bed. So there's a GI prophylaxis in many different healthcare facilities or hospitals where they proactively or preventatively or prophylactically treat GERD by giving people Protonics or pantoprazole on a regular basis. And long-term use of pantoprazole or omeprazole may cause osteoporosis. And remember, we're linking things together. You guys are going to take the NCLEX when you think about a bunch of things. Bone disorders, increase intake of calcium and vitamin D, also weight-bearing exercises with those people with bone problems. So next one's going to be laxatives. Laxatives, first you got your psyllium. This is the bulk former. This is the Metamucil. That's usually a little orange powder. Put it in your little drink, stir it up, give it a go. This helps form up your stools to help with elimination. The next one is your decussate or Colace. Usually when I give this, it's always a little orange gel pill. This one pulls in water. It's a stool softener. Bisocal or Dulcolax, what's that do? Stimulates GI motility or peristalsis. It helps that GI movement. Or magnesium hydroxide or magcitrate. This is the big gun. This is the tank. It comes in. It messes your GI tract up. It does work in there, okay? So watch when you give that one. Look, of course, always with diarrhea, consider what other electrolyte imbalances can happen. When there's fluid changes, that's when you can get hypokalemia, right? So watch for that. Look for signs and symptoms of dehydration. So the next medication is going to be your Ondansetron or your Zofran. This is an antiemetic. This is given for nausea. You should give it when? Before somebody is nauseated. You're going to get, if a patient's going to get chemo, pre-medicate. All right. But this medication's common adverse effects are what? Headaches. And then the more riskier one is it can cause widened QT intervals, which may lead to a dysrhythmia. Absolutely. The next one is another antiemetic, but this one is also an antihistamine, I said. This is Phenergan, or this is Promethazine, right? With this medication, it can be given for nausea, but since we know it's an antihistamine, what's another antihistamine? Diphenhydramine. What happens when you take Benadryl? It makes you drowsy. Yes. So with this one, you're also going to give this IV. If you give it IV, it should be what? It should be diluted. It should be pushed slow. It's a high-risk vesicant. You got to watch out for that. So the next medication is going to be Lactulose or Cephulac. This is given for hepatic encephalopathy or people that have high ammonia levels, specifically people with high ammonia levels. Lactulose binds ammonia in your GI tract and it helps you eliminate it, right? So this medication helps with constipation, but definitely with hyperammonia levels, and it should improve your mental status. How do you know this medication is being effective? People start becoming a lot more oriented to the set of circumstances that are going on. This might also lower the pH in your colon, and this promotes excretion of the ammonia. So it can cause GI upset, electrolyte imbalances, and hyperglycemia. Anything with excessive diarrhea can do that. The next medication is going to be lopramide or Imodium. So we talked about this. Before we were given laxatives to people that can't eliminate. Lopramide or Imodium is given to people with diarrhea. You got it. So also Lamodal is a prescribed medication that has the diphenoxylate and atropine in it. What is an atropine? It's an anticholinergic. What did I say about anticholinergics? What do we want to remember? Reach. Can't see, can't pee, can't spit, can't poop, right? So it dries you out. Diphenoxylate is a narcotic, works on the narcotic receptor, slows down that GI motility. Anticholinergics straight up dry you out. It makes sense this is given for diarrhea, all right? So watch for this. It can cause drowsiness, and look for dependence with the diphenoxylate Lamodal medication. The next medication was the metoclopramide that I talked about, also known as Reglan. Metoclopramide is given for people that have slow GI motility, but also it's given as a nausea medication. You want to watch giving this if somebody has a bowel obstruction or something like that. If you give them metoclopramide, it actually might cause a perf, okay? So that's kind of a contraindication. It increases peristalsis, but you don't want too much stuff going on. If you've got an obstruction, it's widening out your bowel. So metoclopramide, given for nausea, vomiting, given for gastroparesis, for GERD. This increases GI peristalsis and also motility. But this has the more serious adverse effects, which are what? The EPS, which stands for extrapyramidal symptoms. This can cause rigidity, tremors, twitching, tardive dyskinesia, Parkinsonism, right? The uncontrolled movements. The next medication that we're going to talk about is the iron, which is the last one that sums up this quick and dirty video. Iron should be taken on an empty stomach. Should be taken with orange juice or vitamin C to increase absorption. It should be drank through a straw because it will stain your teeth. Next, if you're going to give an IM injection, you should use the Z-Track method. The Z-Track method will prevent it from staining your skin because we know it's a dark solution. And then also with the Z-Track method, we should move your skin how far? Should be 1 inch. And people with that iron deficiency, you want to educate foods and tell them to increase foods that have iron in them. And looking at Google, just the top list of them, I'm telling you, it's going to be spinach, tofu, lentils, dark chocolate, sprouting broccoli. That's so weird, it says sprouting broccoli. Oysters, dried apricots, beef, sardines, baked potatoes, meats, and beans. All right. So that's going to wrap it up for all the GI drugs, quick and dirty. There's a little bit more information, and it's more compartmentalized than my other 3 GI videos. Hit like, follow. There's more pharm to come. Thanks for sticking with us, guys.